Thank you for joining Mye Journey, a series of podcasts focusing on a multiple myeloma expert and her patient's journey from diagnosis to what the future may hold. This episode of Mye Journey is presented by Duke Cancer Institute and is funded by donations to the Multiple Myeloma Research Fund. Neither Dr. Gasparetto nor Thomas Goode have been compensated for their participation in this program.
I currently serve as a consultant and speaker to a number of pharmaceutical companies and treatment organizations. And for the most up-to-date list of my disclosures, please go to my page at dukehealth.org.
My name is Thomas Goode, and disclosures include working with GlaxoSmithKline.
This video podcast is the fourth and final series in 4 podcasts featuring Dr. Cristina Gasparetto and her patient Thomas in a really candid conversation about their physician-patient journey. Their journey includes building a strong, open relationship to help support their struggles, successes, and the path to the future. In the previous episode, Dr. Gasparetto and Thomas shared stories of the value of their relationship when facing tough and triumphant times along the journey. Our last episode will focus on the importance of patient support systems that offer encouragement and often solutions to patients. So, Dr. Gasparetto and Thomas, I know both of you are eager to share with other multiple myeloma patients how to find support and also be advocates for other patients. And I'd like to hear from you both, starting out about, the type and where that patients can find support groups.
Being at the clinic, Dr. Gasparetto said that, hey, I want you to start a support group. And at first I thought it was just right there at Duke, for the myeloma patients that come to Duke. And then we was like, no, you know what? We reached out into the community and found out that it was patients at the surrounding hospitals, myeloma patients, that needed support as well. So once we started that support group, once me and 2 others, we started that support group, we had an opportunity to reach out to a lot of patients that was in desperate need of support. And it became a good outlet for everybody. These patients, the thing about it is we had 2 different perspectives. You had Duke's perspective over here. We had patients from UNC. We had patients from Rex and Baptist. We had a lot of patients in the surrounding area. So we can get different perspectives about the treatment plans, the treatments. So when these patients come to us, we can say, hey, this is what we've done at Duke. And then now I can ask them questions about how they're treated at their facilities. And it brings so many people together just by knowing those perspectives, those different perspectives, because now that's a way that you can add to your questionings when you go in front of the doctor. You can say, hey, well, what about this? What about this? You're not telling them what to do. You're giving them a sense of direction, saying, okay, I heard about this. Could you elaborate on this? Or will this work for my treatment plan as well?
The idea, there are many support groups, particularly for cancer support group, but we wanted to establish something specific for myeloma, unique and different cancer. And one of the things that I was always kind of a little bit surprised at the beginning, I'm not surprised anymore, when I started the interactions with patients, the fact that many didn't know about this disease. And for us, it's a little bit of a surprise because multiple myeloma is the second most common blood cancer only after lymphoma. So we actually, if you start to talk with people, people knows they have friends, etc. And the lack of informations, and so I wanted Thomas and these other two patients to reach out in the community. I wanted to increase the awareness in the community, and that's the reason why I did several initiatives. First of all, I wrote a book, Understanding Multiple Myeloma, which was dedicated to all my patients, written for them and for their caregiver in a simple way. And I need to update that book because so many new drugs have been come out, since we published a few years ago. And then increasing the awareness, I established a multiple myeloma bike ride with both avid riders, and I actually introduced Thomas to riding, and lots of patients were coming and being riding themselves or support, the volunteers. And I wanted to increase the awareness in this area of the disease, and so having a support group was very important because patients were going. A lot of patients are afraid to ask questions. They are intimidated. The relationship that they have with the physicians is intimidating sometimes. And so it was a good way for patients to be in a room all together, sharing their experience, and also asking questions. And Thomas had a great idea of developing, the location was perfect, and also the idea of inviting some expert, you invited physicians, APPs, nurses, a different perspective of the disease, and talking about all the infrastructure, right, and the importance of having this infrastructure in order to be a successful story.
Mm-hmm. And with the support group, I found a way to keep everybody in tune with their myeloma.
Yeah.
Some of the things that they're going through, I try to find speakers or someone that can relate to what they're dealing with, so that they can put a answer to some of the questions that they have.
You're right.
So support groups are very, very, very helpful when it comes to myeloma patients. Some people feel like they don't want support, they don't need support, rather, especially in the African American community.
Right.
African American men feel that it's weakness, a sign of weakness, if they want support. And that's just a stigma that we have to try and overcome those barriers, to provide the information for them, so that they don't feel like that. However, one of the things that I do is I will meet them where they are. Let's say that if it's a guy who's not interested in coming to support groups, me and him may go to lunch one day and talk about some of the things that he's dealing with, and that's one of the things that I do to help him out, to answer some of the questions that he may have and point him in a right direction.
Right. You are absolutely correct. There is a lot of cultural barriers, and it's different for different type of patients. Asking the proper questions, and the reason why you want to, as a patient, have a foot in the academia, because we provide patients with a different, newer approach. The clinical trials, they're very important. Some patients have exhausted whatever is available off the shelves, so we have clinical trials, and there is a lot of mistrust about participation in a clinical trial, particularly from African American, and is always a minority. If you look at the number of patients undergoing transplant every year, the Caucasian versus the African American, and the clinical trial. And so we want to understand that. We want to is cultural, is trusting the physician access, socioeconomic factors, and how can we help? Because ultimately a clinical trial can save your life. And as I was mentioned earlier, the war, all the drugs that you went through and they were available to you, it was because many patients participated to these clinical trials, and some patients were able to live longer because these clinical trials and saved the life not only for themselves but for other patients coming after. So very, very important. So when we offer a clinical trial is because we know that we have to explore a different way to treat your myeloma, right? So information, understanding the disease, asking the proper questions, and then relying on us to guide you during your treatment journey.
Well, you shared some really important information about how people can get support, not just people that are newly diagnosed, but people that have been living with multiple myeloma for some time. But I mentioned earlier in the podcast a little bit about patient advocacy, and in my conversations with you both, I have been really interested in finding out more about the issues that benefit from patient advocacy that you both support.
I was well into my myeloma journey before I became a patient advocate. Probably at least 5 years, maybe. And that's one thing that I do regret is not, being more in the forefront at the beginning of my journey. But once I hit the ground, I would hit the ground running. Well, I started with a voice video I did with the Myeloma Foundation.
Yeah.
And then some people reached out to me and you about doing a video, basically about almost like the same thing. The importance of having a great doctor-patient relationship. And then I became a advocate for a pharmaceutical company. And then I traveled across the country, talked about, my treatment and their medication. And then it just spearheaded from there. Once I started talking about my journey and everything that was going on, I had a story to tell. And it's a unique story. And my unique story actually helped a lot of people in the process because they was like, wow, you've been through a lot, but look at you now. And that's what I try to use that to go through all of my, anything that I deal with myeloma. I let what I'm dealing with or how I feel shine on everybody else. And that motivates me to become better.
Yeah, no, I totally agree. I think that is a journey, and my job is to provide with more information, access, but ultimately, they don't need just me. They need the village, right? They need other patient support. They need. We didn't talk much about the importance of having your caregivers, your group of people supporting you, because patient will not be able to function by themselves if they don't have their own support group. So the importance of caregiver. We establish a relationship with this. Lots of phenomenal caregivers, and they're teaching us a lot because it's a tough, it's a tough role. If you are the wife, the spouse, the mother, the siblings, of a patient undergoing that journey. And so it's for everybody, spreading, increasing the awareness, and how can we help the patients, talking with other patients, talking with your physician, making the right decision, and also having the village bringing you to a success story. like in his situation, right?
Right.
I know you both mentioned some factors that may cause disparity in patient care that you've touched on here, like race, access, socioeconomic factors, access to major clinics. Anything else you'd like to add about that and how, people that are involved, like you two, and have that bond and that relationship that you can help people understand those?
In the African American community, it's about building trust.
Yeah.
Mostly, it's about building trust. Once someone is able to trust the physician, then maybe they will be considered about going further with treatments and stem cell transplants and clinical trials. Because like she's mentioned before, people don't want to feel like they're a guinea pig if they go into a trial. And that's where I come to the forefront again, because I was like, hey, I've been through clinical trials, 2 for myeloma and numerous others. I said, so you can look at me and say, hey, he's done it, so I can do it. And also, if they was to ask me, did the clinical trial not work? My answer is, who is it to say that it didn't work? It just got me to the next line of treatment.
Exactly. Yeah.
Thank you for sharing that. As we bring this last episode to an end, do either of you have any other comments or anything else you'd like to share with our audience?
I think we touched on a lot of important, part, the piece of the puzzle to establish a good relationship with your patient and your physician, of course. But I think trust, listening, and it's okay to say your story aloud and allow other people to help you. So opening the door to other people is very important. You can't do it by yourself. You can't.
And I agree. I would also like to add that, it's okay to advocate for yourself.
Yeah.
Growing up in the African American community, the doctor, we was raised that the doctor knows best. So don't question the doctor. But now, you have to. It's okay to question them.
Absolutely.
It's okay to question them and ask them, some questions about what's going on and tell them how you feel.
Exactly. No, I like that. I absolutely appreciate that. You cannot sit and be passive and listening and not participating. I want you to participate, to ask me a lot of questions. I want to make a decision together. Absolutely.
Yes.
Yeah.
All right. Well, thank you both. It's been a really interesting journey about how you've built and sustained this relationship, how it's helped you through the course of good news, bad news. And I think this is going to be a real strong platform going forward, not only for the two of you, but for other physicians and other patients living with multiple myeloma. So thank you for the authenticity of the stories that you've shared and the experiences. I feel like our audience have gotten to know both of you better and understand a way that you've kind of charted those waters in the patient-physician relationship and journey. So thank you very much.
Thank you.
Thank you.